Hello Darshako, hello viewers, welcome once again to my YouTube channel. And in succession to the videos what I have been taking up in gynecology, so today's video I'll be mainly focusing upon very important one of the topics is hysterectomy. So the word we'll be understanding in this video what is hysterectomy, what does it mean, in what all conditions the doctors advise for hysterectomy, and what are the possible outcomes, what are the relief, how the hysterectomy is carried out, what are the types of hysterectomy, and how what are the clinical procedures, how it is being carried out, and what all precautions after hysterectomy the women who have undergone it they need to take care of. So hysterectomy in a simple one line definition of it, it can be looked upon as it is a surgery which is performed to remove all or part of the uterus. All right. So basically, hysterectomy, it is the surgical removal of the uterus where a part of the uterus can be either removed or all of the uterus can be removed. So in order to understand this procedure for the general people who are watching this video, we need to have a little bit of understanding about the female reproductive tract. So in the female reproductive tract, we can find that there in the center, if it is the in the center, there lies the uterus, and on either sides of these are the fallopian tubes. These fallopian tubes, they are having finger-like projections, which are called as fimbriae, and outside them are located are the two ovaries. So at the time of ovulation, the ovaries expel out the ovum, and with the help of these fimbriae, the ovum is being trapped, and the finger-like projections of the fimbriae are going to make the egg proceed from the fallopian tube towards the uterus. Now, if the ovum doesn't receive the sperm for fertilization, so already while the journey of the ovum has started, the uterine wall prepares itself with rich blood supply, and if the ovum doesn't get the sperm, so the hormone levels decline, and once the hormone level declines, that leads to the shedding of the uterine wall, and which leads in the menstrual bleeding. So actually in certain situations, in certain women, it is mostly seen that there at the time of menstruation there has to be bleeding, and apart from this, some women might experience abdominal cramps or abdominal pain in the pelvic region. So in such a situation, it is in normal situations this pain can be mild, or it can be easily gone away after once the menstruation has taken place, or most in the normal cases the menstruation with a small amount of bleeding is there, and it is mostly not that unbearable. But in certain situation, if certain women they mostly complain of that during their menstrual period, that is during their menstruation, they have excessive amount of menstrual bleeding, and that too is accompanied by intense abdominal cramps. So they have intense abdominal cramps in such situations, and that pain is unbearable. So in such situations, the doctors they mostly advise that either to get rid of the situation when the painful menses, the painful menstruation, apart from this the heavy menstrual bleeding, if it is not being treated, if they are unable to treat with the help of other treatment modalities, last resort is to go for the surgical removal of the uterus. So in the last resort, what the doctors opt for it, that they would suggest the patient for hysterectomy. So what happens is that during the hysterectomy procedure, so we have had a basic idea that this is the uterus. The uterus next it proceeds into a thinner, it narrows down in the form of a cervix, and later on this progresses into a small opening, which is the vagina. So above the vagina there are the labia majora, the labia minora, that is the vulva, and the mons pubis and all such things are there. So in the process of hysterectomy, there can be the surgery what is being conducted, what the operation is there. In such an operation, the doctors mostly go for such a surgery where only the uterus can be is taken off, and along with it a part of the cervix is also removed. So such a hysterectomy procedure where the uterus and along with it the cervical part of the uterus, that is the cervix, is also removed. It is referred to as a total hysterectomy. Now, another type of hysterectomy what is being carried out, it is called as the partial hysterectomy or the supracervical hysterectomy. Now, in such a procedure, during such a surgical procedure, what is going to happen is the surgeons are going to excise or remove the uterus along with they are going to spare the cervix. So in partial hysterectomy or supracervical means the hysterectomy is being conducted above the cervix, that is the cervix is being spared. Supracervical means from above the cervix the uterus will be removed. So it is also called as supracervical hysterectomy where the cervix is spared and only the above portion of the uterus is being surgically excised. So it is also called as supracervical or subtotal hysterectomy. Now moving on, so to the important, what are the causes? So already I have said that if the menstrual bleeding is uncontrolled, it's a heavy menstrual bleeding, and if the during the process of menstruation there is intense pain, there is an intense abdominal cramping, which in medical terminology it is called as dysmenorrhea. So in such situations of intense menstrual bleeding and excessive pain, so such situations are the indications for hysterectomy. Apart from this, if a woman of a younger age group or in any age group of the women, it has been found that certain women are more predisposed to certain kinds of fibroids, and these fibroids or there is recurrent uterine polyps are being formed. So during in the intestine there can be abnormal outgrowths or outpouching or projections of a small polyp inside the uterine cavity. So in such situations also, on cases of fibroids and recurrent uterine polyps, hysterectomy becomes the treatment of choice. Now, apart from this, next very important situation is in the cancer of the uterus. So if it is the CA of uterus, in such situations also doctors, they mostly go for a hysterectomy. Apart from this, next is the uterus prolapse. Now, what is this uterus prolapse? In one line, we'll try to understand what is the meaning of uterus prolapse and what is this situation. Now, in certain instances, it has been found that the abdominal muscles of the women, in certain situations, there is weakening of the abdominal muscles. As a result, what happens is, since there is weakening of the abdominal muscles that in the pelvic region, so the uterus is going to drop down into the vaginal or the birth canal. So in such a situation, the uterus falls into the vaginal canal. So such a situation of dropping down of the uterus into the birth canal, it is referred to as the uterus prolapse. It is referred to as uterus prolapse. And what do we find in uterus prolapse is that the outcome, the consequences, what is mostly seen, there is urinary incontinence. That is, such a female is unable to hold on the urine. There is the urinary bladder is unable to hold the urine. Apart from this, there is difficulty in the bowel movement as well. So such a situation is leading to this kind of problems what is associated with uterine prolapse. So in situations of uterus prolapse also, doctors, they mostly suggest for hysterectomy. Apart from this, looking at the operation scheduling, so mostly when the doctors are going to admit the patient, they are admitted a day prior, and they'll be monitored for the heart rate and everything, and the intravenous drug line or the whatever the necessary medications they need to be administered, they'll be given. The procedure of the hysterectomy is to be carried out under general anesthesia. So the anesthesiologist, his intervention is a must. The anesthetist will come and take into the general anesthesia procedure. Apart from this, the regional anesthesia is also given, which is the epidural anesthesia in the lower back region. So after the surgery, once the patient is during the recovery phase, so after the surgery, once the patient gets into conscious, that regional anesthesia is going to make the area of the operation site numb, so that the patient doesn't feel any pain. So this was all about the operation procedure, and most of the important questions what very frequently people ask is how long is the admission into the hospital. So a day prior they'll be admitted to the hospital, and such patients need to be, depending upon the type of the hysterectomy procedure, either it can be a vaginal hysterectomy they can perform, either it can be an abdominal hysterectomy, or it can be a laparoscopic hysterectomy. So depending upon the treatment, the surgical modality, what the doctors are adopting. So maximum in cases of if it is an abdominal one, so the patient needs to be in the hospital admission for the upcoming 5 days, 5 days after the surgery, and once for a complete relieving of the symptoms. So after the surgery, the patient gets back into normal routine. It is mostly seen after uh, 4 to 6 weeks after the surgery has been taken place. The patients can resume back to the normal day-to-day routine procedures. So now, another important concern, what is mostly seen, is the husbands of such women. They mostly inquire that what is going to happen to their wives. Are there any problems related to these sexual problems, sexual cycles or something, or either they'll be having any discomfort during the process of sexual intercourse. So these are certain queries. So it has mostly seen. Now we need to understand a little bit about the hormones, what are being getting affected. So basically, if it is normal hysterectomy, that is the total hysterectomy procedure is there, where the uterus and the cervix is being removed. In such a situation, the ovaries and rest of the things, rest of the parts are preserved. So actually, there is not that much decline of the female hormones. Alright, so once the female hormones what are being secreted by the ovaries, there is such no decline of the female hormones. So such women, they do not experience the symptoms what are associated to menopause. Apart from this, if in certain situations where it is related to not related to a benign condition, or if it is a malignant condition, so in such a situation, if the ovaries are also removed, so such women, they may experience the symptoms of such as hormonal changes, such as due to hormonal changes they may have mood swings, they may have irritability, depression, and sleeplessness can be seen in such women. So if ovaries are not if ovaries are also removed, the emotional symptoms, they become more distinct. Apart from this, now one of the very important queries is that what are going to happen to the eggs. So once the uterus is being removed, so this part of the reproductive tract has gone off. So if the ovaries are remaining over there, and once the ovulation what is being taking place every month, where will the ovum go, where will the eggs go? So it is a common query. So what is going to happen is the normal ovulation process will proceed, and the ovaries will come into the abdomen, and with a period of time they will disappear. The next important question what most of the husbands or the male's partner they ask is that where would the sperms go after hysterectomy. So it is it is in a situation where the supracervical hysterectomy is being carried out. So in such a situation, or in a normal total hysterectomy also, if they are going to ejaculate into the vagina, the entire semen is going to persist in the vaginal canal, and along with the vaginal secretions they will also be flushed off once the women goes for through the vaginal secretions they will be flushed off. So as such, the sperms, they won't travel anywhere, they will just lie within this cervical and the vaginal region, and it will be flushed out through the normal vaginal secretions. Apart from this, there is very important questions that does hysterectomy affect the sexual functions. So as such, there has been no documentation of any such adverse effects with hysterectomy, and no adverse effects on sexual functions is found. If vagina is not is not short excessively. So in such a situation, if the ovaries are preserved, so there is as such no loss of sexual desire, there is no loss of libido, and there is as such an increased frequency of sex can also be found. So if the hysterectomy procedure is being carried out for a benign condition. So this was the procedure for hysterectomy, and very important fact is that after the hysterectomy is being carried out, such females, they are unable to conceive, and they'll be not having the menstrual cycle, the menstrual pains and menstrual bleeding they won't be having. Apart from this, when we look at the benefits of it, so obviously the benefits will lead to that there will be stopping of the excessive bleeding, the heavy bleeding what they were frequently having previously. So the benefit will be stopping of the abnormal bleeding, heavy bleeding, relieving from the chronic pain which was in the form of cramps what they used to experience, and restoring pain-free sex. So these are the benefits what can be most found, that these are the benefits what the patients can incur after the hysterectomy procedure is being successfully conducted. So viewers and students who this was a very short discussion where I tried my level best to simplify what is hysterectomy, the clinical conditions which predispose to hysterectomy, apart from this the types of hysterectomy, and the risk and the benefits what the patients can get. So if you still have any queries or comments, you are most welcome to comment me in the comment section. And viewers and students who are new to my channel, they haven't subscribed, subscribe. And if you like this video, give this video a thumbs up, and don't forget to press the bell icon so that you can be further updated for my upcoming videos. Thank you for watching.